A hoodie. Okay. Can I get you to stand up and step back from the computer so we can get you all in? You might want to take that chair back because we're going to need it in a second. Good stuff. All right. So I want you to hitch your hoodie up so I can see your abs. I want it up to the bottom of your rib cage. That's pretty good. So we're just getting a look at what's going on here, asymmetry of those muscles on the side of the abs there. Nice hoodie, by the way. Should have pointed that out. And so, you know, get the patient to tuck that shirt up if they can, and just put your hands on your hips now. And the reason I get patients to put their hands on their hips is they know where those bones are. It's hard to see them from this far, but you can see where those hands are. You're looking for leg length discrepancy or any asymmetry in shoulder height, any little clue that there's something a little off here. So hands on the hips gives you that. And then I'm going to just get you to turn to your right by 90 degrees so you're side onto the camera. And obviously, hip and groin pain can come from the back, can come from the sacroiliac joint, and so you can't just examine the hips. So we're going to do a little bit of back stuff. Keeping your legs straight, I want you to run your hands down the front of your thighs and try and touch your toes. And we're just looking at how well he goes down there, much better than me, and come back up again. Any discomfort at all doing that, Mark? And then hands on your hips and arch your back as far as you can go. And pretty good range. And no pain in the hip or groin with that. Standing up, turn to the right again by 90 degrees so you're facing away from the camera. I just want you to run your hands down the front of your thighs again and touch your toes one more time. This time, what we're looking at is whether there's any scoliosis coming back up again for me, Mark. This is a good position to look for wasting of the hamstring. So if they've got hamstring pain or they've had a snap or a tear, get them to pull their shorts up as they do that. Can you turn to the right one more time for me? And this time we're just looking at his relaxed posture. It's the time to remember what's his lordosis doing, where's his head position, is there a hip flexion deformity or knee hyperextension, and then turning back to the front. And I'll just get you to take your right hand and run it straight down your side as far as you can comfortably get. Any pain with that? No, come back up and down to the other side. That's great. So obviously we're looking for any asymmetry in movement. We're also looking to see if we can reproduce the patient's pain with that. Okay, so I just want you to walk away from the camera to the couch. So sometimes I'll get them to walk towards the camera, turn around and walk right up to the camera for me. We're just looking at that symmetry of movement. Turn around and walk back onto your mat for me. Is there any significant sway to one side, any shift, any Trendelenburg of that gait, and back to facing me? If you put your feet together and roll your ankles out as wide as you can get them to go, we're looking at that subtalar movement. Could be too much, could be too little, and then feet wider than your hips apart. And squeeze your knees together, roll those ankles in. And again, really nice movement there. So back to the middle. So Mark, no sign of a coalition, no subtalar stiffness, no biomechanical issue that's going to be throwing an effect up that kinetic chain. So with your feet about hip width apart, keeping your heels on the floor, I just want you to squat as low as you can comfortably get. That's really good. So this is a real good little screen for a bunch of things. It's for hip impingement, it's for anterior knee pain, it's for ankle dorsiflexion impingement or calf tightness. You see a whole lot with that. If you come up onto your toes this time and come down into a squat, keeping those heels off the ground, show me how you go with that. And this is really pushing those hips a lot further into flexion and back up again. And if you want to, you can get them to do a little duck walk at the bottom. So drop on down. This guy's a tuned athlete. Look at that, effortless, and back up again. Perfect. So now what I'm going to get you to do is just try balancing on your right leg for me. And I just want you to do 3 little short knee bends, dropping that knee in front of your toes and back up again. So again, hands on the hips, nice, because you can see if there's a drop. It's harder to tell when they're not there. You're looking for that pelvis, the knee alignment, whether he's got good proprioception. Some people, you can tell before they even start that they've lost their proprioception on that side. And show me the same on the other side. All right, that's good. Now what I want you to do is just, we'll stop you there. With your hands on your hips, I just want you to balance back on your right leg and just lift that left hip higher. So that's exactly right. So that left hand goes higher than the right. And normally I get people to stand here for 30 seconds because this will slowly bring on their pain in that trochanteric or gluteal region, and do the same on the other side. That's great. On your other side, we'll get you to do a weight-bearing hip rotation. So this time I want you to balance on that left leg, exactly. Turn to the, yep, exactly. So I say turn to the left as far as you can, turn to the right as far as you can. Is there any pain at all with that? So this is a test for a couple of things. It's capsular length, it's a weight-bearing grind for osteoarthritis of the hip joint. All right, so we're going to do a little bit of a strength test now. Can I get you to walk on your tiptoes 5 steps in a row? Good. And no difference between the two sides when you do that. Same on your heels. Get those toes as high as you can. We're trying to see how high they come. Yep, that's really good. And then back on your right foot, can you give me 3 hops? So this is a little bit of a test for gastroc, but it's also a test for that femoral neck stress fracture. So people with a femoral neck stress fracture can't hop, or they have pain when they land. They often hop with their eyebrows, so as they try to get up, they're jerking their eyebrows up. The last thing is just marching on the spot, knees up to waist height. So I want you to get those knees up high, 5 steps on each side. So we're trying to just fatigue those hip flexors a little bit. No difference between the two sides. Great stuff. Grab a seat facing the camera for me, because now we're going to carry on and test them a little bit more. So with you sitting there, I just want you to put both hands on your right knee and then lift up as hard as you can with your knee and push down. So both hands on one leg, hard as you can, and then stop that and do it on the other side. Is there any difference in your strength when you do that? Nope. And then straighten your leg out, that right leg, and do the same thing with your leg straight. This is going to hurt a little bit if your hammies are tight. No, up on your knee there. Yep, it doesn't really matter. We're just trying to put it in a position of discomfort here, and the same on the other side. And no problems doing that. And then put your fists between your knees and try and hurt them. Squeeze them as hard as you can, really try and hurt them. Any pain, any difference between the two sides with that? So that's an adductor stress test. It's a symphysis stress test. It's just challenging those structures in the groin nicely there. All right, so swing that chair away. And I'm going to get you to lie on the floor, side on to the camera. So I just want you to try just lifting your feet up off the ground for a start and holding them there, both feet at the same time, just a little bit up and hold them there. And do you get any discomfort doing that? Nope, drop them down again. So this is a pelvic ring stress test. It doesn't declare whether it's a symphysis or a sacroiliac joint, but it is stress. It's the active straight leg raise pelvic ring stress test. And so it's one of those things you do to try and help decide, is it sacroiliac joint, is it lumbar, or is it hip? Okay, this time with your right leg, I want you to pull your toes towards your head, keeping that knee straight. Lift it up slowly until you start to feel it run out of rope. You're showing off now, and down again. And just point your toes like a dancer and do the same thing with that pointed. And is there any difference in what you feel there? There's not a big difference in what we see, so that's pretty good. Mind just doing your left side, toes up first, and lift that. Yeah, that's pretty good. And down again, and point, and do it again. So not a lot of difference there. So that's Braggard's sign, is the ankle dorsiflexion, creating increased nerve tension. If there's a more than 10-degree difference there, then you've got some adverse nerve tension, which adds to problems like recurrent hamstring injuries or hamstring origin issues. Okay. So now we're going to test that hip joint. So what I want you to do is take your right knee in both hands and take it to your right shoulder and pull it up as far as you can. Is there any discomfort with that? So this is Dremen sign, inline flexion. If they have pain or they have to bring the knee out to the side, then they've got a retroverted acetabulum or femoroacetabular impingement. Can you take that right knee towards your left shoulder now? So now we're coming into quadrant. Good. I want you to reach down with your left hand and grab your ankle and pull it across your body even further. And now we're stretching the gluteal muscles piriformis. Is there any pain with that? A little bit of discomfort there. Now I want you to swap hands. So your right hand goes down to your ankle and your left hand's at your knee. And I want you to pull them in opposite directions. So bring that ankle away from your midline. That's really good. So this is your impingement quadrant internal rotation. That's great. Now take your knee back so it's pointing straight at the roof. So that's perfect. And now I just want you to try and stretch your butt by taking your knee straight across your body that way. So this is a it's a horizontal adduction stress test. Is there any pain with that? No, that's great. And bring it back and drop your foot down. And put your feet together, bend your knees up halfway, feet on the floor for me, sorry, and drop your knees apart as wide as you can go into that butterfly stretch position. So what we're looking at here is any difference in height of those knees. Is there any increase in lumbar lordosis, which suggests an anterior capsular tightness as he does that? And obviously, if there's any pain, is there any pain with that, Mark? And again, this is going to stress your sacroiliac joint as well. So if there was pain, you'd want to know whereabouts that pain was. All right. So last thing, lying on your side facing me, we're going to just relax with those hips and knees slightly bent. I want you to use your left hand to just feel the muscles of your hip and just probe around in there and tell me if there are any tender spots. Is it tender on the bone? Is it tender behind the bone or above the bone? Is there anything in there that reproduces your pain? So this is one of the tests that those guys from Duke University said was actually quite useful. It was reliable and reproducible. The other test that they suggested was one you do sitting. So, sorry, Mark, I'll get you to grab that chair one more time. I find this a little bit of a challenging one, but we'll see how we go. I haven't had Mark do this. So basically what I want you to do, Mark, and we'll do your right leg first, is I just want you to lift your foot a little bit off the floor. So just a centimetre off the floor. And I want you to take your foot away from your other foot. So you're turning your thigh towards your other knee, but taking your foot away. Yeah, that's right. As far as you can go and hold it for 5 seconds. So that's what they've described. So that's your internal rotation. And now I want you to put that foot on the floor and do the same with your left leg. And so slightly less to me on the left than the right, but reasonably good. Yep. And now this time I want you to go the other way. So with your right foot just off the floor and take it across the front of your shin as far as you can go. So that looks 30 degrees, maybe a little more, and the same on your left. And again, as I say, these guys, and that looks the same to me, these guys described the patient holding it for 5 seconds. Brilliant. So that's it.